Good afternoon. I am Sari Jare Dito Malib from BSM Monday of Holy Trinity University, Group 14 for ROE. And for today's skill acquisition drill video, I'm going to be performing oral care for conscious and unconscious client. So with further ado, let's begin.
Assisting the client with oral care for conscious client edition. Explain the procedure to the client. Come in.
Good morning, ma'am.
Morning.
I am Sari and I will be your nurse for today. Can you state your name and age for me, ma'am?
I'm Irish Lady Corona, 19 years old.
So for today, ma'am, I'm gonna be performing oral care with you. Would that be okay with you, ma'am?
Yes.
Okay.
Collect all instruments required.
So now I'll be collecting all the equipments and materials that I will be needing to proceed with the said procedure. So I've already prepared the equipments beforehand on this chair.
Close the door.
And now I will be closing all the doors and windows.
Perform hand hygiene and wear disposable gloves.
And assuming that I have already performed medical hand washing, I will now be performing hand hygiene. Using this alcohol. And after performing hand hygiene, I'm gonna be wearing my disposable gloves. So now, let's assume that I am wearing one.
Assist the client a comfortable upright position.
Okay? So as you can see, the client is in a upright position in which she is comfortable enough.
Inspect the oral cavity. Inspect hold the oral cavity such as teeth, gums, mucosa, and gums, and with padded with gauze pad and tongue depressor and torch. Take note if you find any abnormalities such as bleeding, swallow, then ulcers, and gas.
Okay, so now I will be inspecting the client's mouth using a tongue depressor and observe if there are any bleeding, swollen, and ulcers and mouth sores. So now I will be using this tongue depressor. So now let's assume that this tongue depressor is padded with gauze pad. And I'm just gonna use my torch or my pen light to inspect the client's mouth. Okay, ma'am? So can you open up your mouth for me, ma'am? Okay. So I'm just gonna observe it now if there are any abnormalities within your mouth. Okay.
Oh my God!
Okay. So now I observe that the client's mouth has no any abnormalities that is present.
Place a face towel over the client's chest or back.
So I will be using this face towel and put this under the client's chin. Okay, now. So I'm just gonna put this under your chin. Okay.
Put kidney tray in the hand or assist the client holding a kidney tray.
Okay. And after that, I'm just gonna use this kidney tray and I'm gonna let the client hold this if she is able to. Or in other way, I'm gonna assist her holding this kidney tray. So ma'am, I'm just gonna put this kidney tray here, okay?
Instruct the client to brush the teeth. Point of instruction.
So ma'am, I want you to brush your teeth using this toothbrush, ma'am.
Next is, if the client cannot tolerate the toothbrush form swabs or cotton balls can be used.
So ma'am, can you tolerate using this toothbrush po or would you want to use a foam swab or cotton balls po?
I prefer the toothbrush.
Okay ma'am.
Rinse oral cavity as the client to rinse with fresh water to avoid.
Ma'am, this is a toothbrush ma'am, okay? Ma'am, thank you. So, now ma'am, you can use this water to rinse your mouth. Okay, so ma'am, do you want me to assist you with wiping your mouth using the towel that I have put under your chin?
No, I can.
Okay, so you can do it ma'am. Okay, thank you.
Confirm the condition of the client's teeth, gums, and tongue. Apply moisturizer and rinse the toothbrush thoroughly.
Okay, so ma'am, how are you feeling with your oral care ma'am?
I think
Okay, so now I'm gonna have you to use this lip moisturizer that I have here. Okay, ma'am. Okay, thank you.
rinse the toothbrush thoroughly and return to the proper place.
Okay, so now I'm just gonna rinse this toothbrush in this kidney tray and return it to its proper place.
Replace all equipment.
And after that, I'm gonna replace all the equipments that I have used in this procedure.
Discard dirt properly and safely.
Okay. So, okay.
Remove the hands. Remove the gloves and wash your hands.
So now I'm gonna remove my gloves and dispose it. And after disposing it, I'm gonna perform medical hand washing. So assuming that I am doing one. And after that, I'm gonna perform hand hygiene.
Care and signs on the record. Document the care and signs on the record.
And after performing hand hygiene, I'm gonna document the procedure with my signature in it on the client's record or client's chart.
Report any findings.
Lastly, I'm gonna report all the findings that I have gathered and reported to the senior staff. Now let's move on to the unconscious client procedure of skill acquisition drill.
Providing oral care for independent client. Come in, check the client's identification.
So, good morning ma'am. I am Sarah Joy Kumali and I will be your nurse today. Ma'am, can you state your name for me ma'am?
I'm Irish Mikawanan, 19 years old.
Okay, thank you.
State the purpose.
So ma'am, for today, I'm gonna be performing oral care with you. Would that be okay with you ma'am?
Perform hand hygiene and rinse.
So, assuming that I have already performed medical hand washing, I will now be performing hand hygiene. And after performing hand hygiene, let's assume that I will now wear disposable gloves. And after that, I'm gonna have to prepare all the equipments needed with this procedure, which I have already prepared beforehand.
Use clean tap water, soap or cotton balls in solution with artillery porcelain and squeeze or cotton balls and excess solution.
Okay? So let's assume that I am using an artery forceps to soak the cotton balls. Okay?
Close the curtain.
Now I will close the curtains to provide client privacy.
Put the client in a side lining.
Okay, so ma'am, can you turn your face this way? Okay.
Place the rubber sheet and towel on the neck of the client.
So now I will use this towel and put this under the client's chin or on her chest.
Put the footage over the towel with rubber sheet.
So assuming that this is a draw sheet, I will use this to cover the base towel that I have placed under the client's chin. And I'm gonna put this kidney tray under it. So now I will be inspecting the oral cavity of the client using this tongue depressor. So let's assume that this tongue depressor is padded with gauze pad. And now I will have to inspect it using this one and this pen light. So ma'am,
Clean oral surfaces of client mouth. This not is spoken box as the client open the mouth and insert the padded mouth. Leave the client being from its scissors to remove and using the up and down movement from time to time. Feel the client's feet from its scissors to molar using up and down movement. Clean oral cavity from proximal to distal using the methods.
so assuming that this is a cotton ball with stick, I will use this to clean the client's mouth. So ma'am, open up your mouth. Okay. So some molars. Okay.
Use cotton ball in this
So now I will be discarding this cotton balls that I have used with the client's mouth. Clean down. And now I will clean the client's tongue from inner to outer. Okay. And dispose it in the kidney stream. Okay. So now I'm gonna rinse the client's mouth using this glass of tap water and suction it using this small syringe. So open the client's mouth. And suction the remaining parts. Okay, and dispose it in the kidney stream. Okay. Now I'm going to confirm the condition of the client. So I presume that she is comfortable enough with her physician. So now I'm gonna wipe the client's mouth using the towel that I have placed on her chest. Okay. And apply some lip moisturizer on her lips. Okay, now. Okay, so now I will have to reposition the client on her comfortable state or in a comfortable position. So now let's place the head. Okay. So now I will replace all the equipment that I have used with this procedure. And after that, I'm gonna have to discard all the threads that I have used. And after that, I'm gonna remove my gloves, put this in the trash can. Perform medical hand washing, so let's assume that I have already performed it, and perform medical hand hygiene. And after that, I'm gonna have to document the procedure for oral care for unconscious client with my signature in it, and report any significant findings to the senior staff.